I talked to one of the former people who presented here in this room last year, and she said the microphone works, so we brought batteries and put it in the microphone. And the microphone works, but we can't get it to connect to the speakers. So, you know, the journey continues. Hopefully, we'll bring somebody from AV, from Renaissance next to try and solve that issue. The first week, we talked about what I would call the engine of the body, the metabolism, and the second week, we talked about the pumps and the pipes. This week, we're going to talk about the wiring. Up to this point, it's been pretty prescribed, and I appreciate everybody who sent in their class surveys. I haven't started looking through them yet, but I will before the next class. And so anybody, there's still time for people who haven't gotten the class surveys in to get those in to help me plan what we're going to cover in the last 3 weeks. So today we're going to talk about the neurologic disorders. But last week we ran a little short on time, so I wanted to double back and pick up a few things that were at the end of the arterial disorders discussion that we didn't get a chance to hit. Remember, you're an experiment of one, but keeping it simple for the arterial system is the inflammation, which is basically determined by what you eat, and that can get reversed in days, weeks, and months, days and weeks. And the blockages, which are those cholesterol buildup that you've heard so much about, those things can go away over months and years, just like they were formed over months and years. And we talked about the omega-3s and omega-6s into a little bit of the biochemistry, but basically caution you about fish oil and the use of isolated supplements. And we're going to get into supplements a little bit more today because B12 relates to the nervous system more than any other system. We've all done learning in our life, and Prochaska's model of learning, called the trans-theoretical model, James Prochaska, who wrote a book called Changing for Good, talks about the contemplation, pre-contemplation, planning, action, maintenance, and termination phases, and coined the term recycling. People get into these stages and they recycle back and forth. That's how we learn. His father, Prochaska's father, drank himself to death when he was in college, and that got him interested in why people do self-destructive behaviors. And the first thing he studied as a psychology professor at Rhode Island University was smoking cessation. And in my profession, if you came into my office and you were a smoker, I'd send you to the Kaiser Permanente stop smoking classes. And then, of course, if you didn't stop smoking, where was the problem? Was it in our classes or was it you? It was always the patient who's the problem, correct? So what he figured out was that's not the case. It's more the process. And he found that people who successfully quit smoking quit 4 times in the year that they finally are successful at quitting. So people go through these phases. So they did one study on diet down in 2006, and they found that people, about 58% of people were pre-contemplation. They weren't even thinking about changing their diet at all. Whereas another 5% were thinking about changing their diet. Some were actually planning and preparing to change it. Some were actually changing it. And some had changed their diet and were successful over time. They were in what's called the maintenance phase. So my guess is that when you started with this course, most of you were sort of thinking about doing some stuff for your health, but really weren't sure where to go. And now you're hooked into somebody who's feeding you knowledge like a fire hose out of a fire hydrant. So what I would ask you to do is to pick a specific goal you have in mind and think about what you want to do next as far as preparation and moving into the action phase. And if you recycle or you fall off the wagon, as Doug Lyle says, don't be hard on yourself, because everybody falls off the wagon. Now, AA will tell you that all alcoholics are at risk for relapsing, but the studies show that about 10 or 12% of alcoholics stop drinking and will never have another drink the rest of their life. They've gone beyond maintenance into a new phase, which is called termination. My wife joined us today, and she's a terminated animal products eater because she's heavily into animal rights and teaches us stuff all the time. So she's terminated. I'm pretty much terminated, but given the right circumstances, I might fall off the wagon. Not that I would ever admit to that. This is Doug Lyle. I introduced you to him last week. He runs Esteem Dynamics, and some of the pre-readings one of them was on his video on willpower. I don't know how many people saw that. Willpower, actually, everybody talks about how much willpower it takes to do things. It's not a problem with not enough willpower. Everybody wakes up in the morning with the same amount of willpower. As you go through the day, it gets depleted. Most of you have probably found out that it's late in the day when you fall off the wagon. At least that works for me. So the things that are consistent with maintaining a high level of willpower, making you less likely to fall off the wagon in whatever you're trying to accomplish, is eating low energy dense foods. You now know what that means, so that you have a constant glucose level throughout the day. Doug talked about the very disturbing study with the Israeli parole boards, which showed that if people showed up first thing in the morning, they were paroled. If they were being in front of the parole board right before break, they didn't get paroled. I mean, the difference was like 75%, 25%. Every time these parole board people took a break and ate food, they came back and paroled 75%, and by the next break it was down to 25%. So whether you got paroled or not had nothing to do with what was on your docket. It more had to do with the timing of when you showed up in front of the parole board, which is very sobering to think about. But the other is that organizing your environment, as you go through the day, you're constantly making all sorts of decisions which you're not even aware of, that are wearing down your willpower. And if you have an organized environment, you're not thinking about, well, where did I put this, or what should I do here, or should I ever get around to cleaning this room up again, or anything like that. Exercise seems to be very important, and he encourages people to lay out your exercise clothes early in the morning, so that you exercise first thing in the day, and then it's out of the way, you've done something for yourself. And then finally, good sleep, and we'll talk about sleep in the last class. So that's willpower, and the presentation he did was willpower paradox. So he's big on managing your environment. Now, part of your environment also comprises the support group. Read that as the carbon-based life forms you live with, okay? Those other people in your environment that you have to deal with all the time. He did a nice video that I think I put out in the for this session, was how to get along without going along. When he talks about status, we're basically group animals, and we're constantly, in the groups we travel in, whatever tribe we're in or family we're in, we're constantly checking for how we are as far as our status within that group. Because a long, long time ago, if you got thrown out of the groups, you were basically dead. We needed the tribe to actually support in the environments at that point. So you want to support your willpower and also learn how to deal with the people around you, and a lot has to do with status. I worked with the Permanente Medical Group, and it turned out to be a very bureaucratic organization as we got larger, and I constantly tried to figure out why the politicians who were in positions of authority were not actually creating healthy populations. They were more interested in their position, aka their status within the group, than they were with actually making people healthier. Of course, as I probably mentioned before, if we were to wave a magic wand and create a healthy population, we would need less doctors, less nurses, less hospitals, less procedures, less drugs, all the way around. So it's just interesting to think about some of this stuff from a status standpoint. So today's presentation, does anybody have any questions on either of the first two classes before we go on? I mean, I would encourage you to email me any questions you have, and I'll be glad to get you some additional information. Because remember, what I'm trying to do with the course is expose you to a broad amount of information so you can pick and choose what matters to you now, and then as you go along, it's like putting your foot in the river at the same point every time. You can't do it because the river's moving. Your journey is moving, so you're going to need additional information or stuff at a later point that you may have forgotten or might like to go back to, so you'll have access to all that. Yes, sir.
In that information you gave us on power food for the brain, is said to avoid copper and iron.
Yes.
Pretty hard to do, isn't it?
We'll talk about that, because that Power Foods for the Brain, Neil Barnard's book, which I think I put the clip for his little presentation.
Yes.
It also goes to zinc and aluminum. So we'll talk about that, because that's going to get into dementia, which is one of the things we're going to talk about today. We're going to talk about the wiring. We're going to talk about migraine headaches, dementia, Parkinson's, depression, the mental disorders, essential tremor. We're also going to talk about peripheral neuropathy real quickly. So, going back to our list, remember we're trying to delay death and avoid disability. So we've crossed off cardiovascular disease and diabetes. Today we're going to talk about stroke, Alzheimer's disease. We've also talked about chronic liver disease and non-alcoholic fatty liver disorder. You're going to see medical care is going to be up there as long as we teach the class, because here again, it's the third leading cause of death in the country. And if you can avoid chronic conditions, you will avoid my profession. And if you avoid my profession, just like if you never fly, you're never going to crash, right? But I'll tell you, and we'll get into this a little later, that the airline industry is much safer than my industry is. Except for anesthesia, which has actually got a very good track record. The anesthesia is up around where commercial airlines are. They lose about 1 person out of every 10 million, they're about a Six Sigma organization within the medical group. Most of the rest of us in medicine are down around 2 and 3 Sigma. You can read that as B and C's in school, you know. And disability rise, we've talked about heart trouble and diabetes. Today we'll talk about stroke and mental and emotional problems briefly. So let's talk about some of the brain disorders. These disorders are going to get into what's called the precautionary principle. We've talked about this before, where you do things that you prevent things from happening. In other words, you don't have it. It's in the distant. It's not immediate. It's a little bit like climate change. All indicators are bad, but it's way off in the future. But when you're experiencing the flooding they are in Tennessee and Mississippi right now, and the water's raising in front of your house, it drives an entirely different set of priorities. So we are sort of wired as a species to handle short-term threats better than long-term threats. So the precautionary principle you're going to see today has a lot to do with poisons in the environment. Now Paracelsus actually was a Swiss physician, and he was quoted as saying, all things are poison and nothing is without poison. The dose alone makes it so a thing is not without poison. In other words, dose makes the poison. We can kill you with just about anything. Water, for instance. LD50 is the lethal dose that kills 50% of a species. That's what the LD50 is. And you can look up LD50s for any substance. So for water, it's 90 cc's per kilogram, which is about 6 liters for a 70 kilogram or 150 pound person. Anybody remember the hold your wee for a week? Yeah. She drank 6.3 liters of water to hold her urine to get a game, and it was a Rancho Cordova radio station, and she died of water intoxication. Everybody knows if you jump in a lake or something, you can't swim, you're going to die of water, right? But you're drowned. But this is actually a poison on your system at that level. The venom of the Brazilian wandering spider, which is the most deadly spider in the world, it's also called the banana spider, is very, very small. And polonium, which is what they used, I think, to kill the Russian agent over in Britain or something like that, is even more deadly. Doesn't take much of it at all. So everything is without a poison, but some of the things we have in our environment are slowly eating into our system and causing problems. So that we're going to expose you a little bit to that as we go along today. So first we're going to start off with pain, then we're going to go to peripheral neuropathy, then essential tremor, which is basically the most common neurological condition. Then we're going to head into Parkinson's disease, and finally we're going to dissect out dementia and its causes, and specifically look at Alzheimer's, which is sort of the elephant in the room, actually. So this patient you're going to hear from, I was fortunate enough to do Meals for Health. I mentioned that in previous classes. This is the 2 people you're going to hear from today are from the Berkeley Meals for Health program, which was the Progressive Missionary Baptist Church in, well, it's actually in Berkeley physically, but it might as well be in Oakland because it's like 150 yards from Oakland. But it's on the corner of Martin Luther King and Alcatraz Streets. But it's a primarily African-American church of about 250 people who have an incredible support network. And they brought in Earth Save International's Meals for Health program that we had done up here, and we put it in place down there for 30 individuals. So this is one of the people talking about her results from eating differently for a month.
Because when she first come to me with this, I said, boo. I didn't hardly want to be bothered with it. And you know, she would always give me little notes and things and telling me about this and that. I said, I'm not thinking about Esther. I love meat and I'm going to eat meat. Do you know I haven't had a piece of meat in 30 days? And I was around some barbecue about a week ago, and I thought, how in the world am I going to be able to be around this barbecue and potato salad? Do you know I ignored it? And here I am. And another thing, I'm off most of my medication, not all of it. And I used to couldn't go to bed unless I had to have some pain pills. I haven't had a pain pill. My knee haven't hurt me. I feel much better. And I thank God for this program.
We'll get into the inflammation later on in the class we're going to do a little later. But remember we talked about interventions in complex systems. You get unanticipated consequences. Remember Operation Cat Drop? This lady also lost, she's 81, first off, and she lost 9 pounds. She's off her blood pressure medicine, which is normalized. Her fasting sugars got better. Her low density cholesterols went down. Her reflux was better. Her fatigue was better. Her joint pain was better, and she was on no pain medicine. Now, this is an individual result. Not everybody would get the same results, but you start seeing testimonies like this, you start taking care of patients like that, it reframes your entire thinking about how you deal with patients and what the value of medications are. Now, we covered diabetes, but there was one class, I may have mentioned in the first class, but I wanted to hit it again if I had, and certainly wanted to cover it if I didn't. Up in, there used to be a TB asylum up in Auburn, and it got sold to the Adventists, and they put in a program a residential program where people came and lived for a couple weeks. And Dr. Crane and one of the workers up there named Sample did a study of 21 patients who had diabetes for 12 years and neuropathy. This is painful distal neuropathy. In other words, the nerves in their feet were painful for about 3.5 years. They put them on a low-fat plant diet, exercise for 30 minutes a day. In 4 to 16 days, 17 people had complete relief. And this is a 1994 study. And I'm working at Kaiser Permanente in 2006 or 2005, and I read this study and I'm going, wait a second, this happened right up the street here in Auburn? How come I don't know about this? These are the sort of people I'm giving drugs to on a regular basis, like Elavil, to control their pain. And I'm not sure how many people would have done this sort of thing in an outpatient setting, but I think to myself that I wish I had been able to tell these people about this program when they came in, just to give them the option. At 4-year follow-up, 71% were still on the program. Actually, it was actually a little higher than that because one of the persons had passed away, and it would have been more like 85 or 90%. And they've had continued improvement. So that's peripheral nerve damage caused by diabetes, fixed by purely lifestyle fairly quickly, which is unusual, but it just drives home the point that it's important, and things that you get better in ways that we don't anticipate, and your physicians won't anticipate. Now, essential tremor is just a tremor of the right hand. I actually had this starting, my father had a very severe case of it, and I had a mild when I retired from the first time from the Permanente Medical, well, I retired permanently from the Permanente Medical Group, but I went into an encore career, subsequently to another encore career. Now I'm working on my third. So, but I had a mild one, and when I changed my diet, it actually went away. It got better. And it comes back at times. It's actually, if I over-caffeinate myself, it tends to come back, which is fairly typical for the condition. But it's not an unusual condition. By about age 95, 20% of people have it. Yes, sir.
I was told by a neurologist at Kaiser that peripheral neuropathy was not reversible.
Right.
And I've seen it reversed.
Yeah, he mentioned that peripheral neuropathy is not reversible by a neurologist at Permanente. All I would say is there's lots of different types of peripheral neuropathies. Some are inherited, some are other types. You'll see with Parkinson's there's a tremor, which is a neuropathy of a type, but it's central, not peripheral. And the one we're talking about or talked about was diabetic. So I'm not sure about the others, but
This is diabetic.
Yeah, and it is reversible. There seems to be a genetic predisposition and tends to be linked to the one study on dietary intervention shows that it's due to a heterocyclic amine called harmine, which is what you get when you barbecue meat in the little crust. So the meat consumption, the length of cooking, and it's evidently a 6% increased likelihood for every 10 grams of meat you eat. And also, if you have an essential tremor, you're 4 times the risk for Parkinson's disease, which we're going to talk about next. Yes, ma'am?
And did I hear you right? Did you say this happens only in the right hand?
No, either hand,
Oh.
or both hands. But it's an
I missed
essential,
that.
when we say stuff like essential tremor, we mean we don't know what the heck it is. It's just a tremor, and it can get pretty bad. And we have drugs to treat it, but we're not talking about drugs in this course, but there are drugs to treat it. So Parkinson's disease, I've got a cousin who has it very badly, and I have a good close colleague of mine who worked with me at Rancho Cordova, who is an outstanding behavioralist who passed away from Parkinson's disease, had a very particularly tragic a very severe form of it. And he basically was exposed to pesticides in the form of Agent Orange, because he spent about 5 years as a clinical psychologist in Thailand at the base where they were flying the Agent Orange B-52s out of. But the diagnosis is fairly straightforward. There's tremor, rigidity, slow movement, instability, mental issues. We know pretty much what it looks like when we do autopsies, the problems with the dopamine production in the midbrain. Its prevalence has gone up 5 times since 1980. Anytime you see prevalences jump after 1980, you've got to be very suspicious of an environmental problem. It may not be easy to figure that out. It may be multiple factors, but it's very difficult to figure it out. When I was in medical school, for instance, Alzheimer's was almost non-existent.
Wow.
And of course, the population has gotten older, but it's also gone up dramatically, as has the incidence of Parkinson's disease. So what might be causing it? It's associated with dairy, pesticides, head trauma, and animal fat and protein. When you look at what people consume and are exposed to and look at the incidence of Parkinson's in population studies, that's what it's associated with. That doesn't mean that's what any of those things cause it necessarily, but that's what it's associated with. Although this is an interesting story. The MPTP story was a story actually was in San Jose, where people got exposed to some contaminated drugs that had this particular chemical in it, and they all developed Parkinson's. And these were people in their 30s. And when you start seeing stuff like that, you start thinking there must be something chemical, and it seems to be pesticides seems to be the leading thing. Now the dairy industry will tell you it's not the dairy, it's the pesticides in the dairy. From my standpoint, if you want to avoid and do precautionary principle and avoid and try and do primary prevention, you want to probably avoid dairy for this reason. There are exercise helps, fiber helps, caffeine helps in population studies. There are some phytochemicals, which are those compounds that plants make to sort of protect themselves from insects, the colors in plants. Those are the phytonutrients, the phytochemicals. The trouble is there's like 10 to 20,000 of those things that we've identified so far. And these are just 2 of them that have been identified that seem to, people who consume diets high in these phytochemicals tend to avoid Parkinson's. Now when you talk about dementia, you're talking about several different medical conditions. And if you look at what causes dementia, cognitive impairment, memory problems, Alzheimer's accounts for about 60 or 75%. Vascular, which are small little multiple strokes, that's about 10 or 15%. About 5 or 10% there's both. People have both. And in Parkinson's, some of the Parkinson's patients get dementia. They have a specific type of dementia called Lewy body dementia. But we're going to mainly talk about Alzheimer's now. The vascular stuff, if you keep your blood pressures down and you eat and to avoid arterial conditions, you'll tend to minimize your problems with stroke, as well as if you prevent yourself from being overtreated with antihypertensive medications. This is the elephant in the room. I mean, current costs are $200 billion, and almost equally enough is the unpaid services by family members who take care of Alzheimer's patients. I mean, Anybody ever seen the movie? We saw a movie a long time ago, Where's Papa?
Yeah.
They don't want to put mom in the home, right? So, the families are constantly taking care of people who are dementia. The only good thing about dementia and Alzheimer's disease is that the patient doesn't suffer. They don't know it, usually. The other interesting thing about the personality changes. I've had some of the mildest patients become the most aggressive SOBs you've ever want to see, and I've had some of the most aggressive SOBs become mild like pussycats. So it goes either way, but it's a very frustrating condition, and there are some theories about why it happens. Now, there are a lot of people out there making money on books. Bredesen has a great place down in Nevada, thereabouts, where he treats. It's an Alzheimer's center, and basically people come in there and live, and they throw everything but the kitchen sink at them. Anything that has ever been shown to help dementia in animal studies or human studies. So they've got them eating blueberries and doing crossword puzzles and all this sort of stuff. And I'm not opposed to any of that stuff, but if this is due, like it looks like it is, based on a long-term poisoning of your central nervous system, the best step is to prevent it from happening in the first place. So if you read Barnard's book, Neil alluded to some of these problems, as Lee mentioned earlier. He mentioned copper and iron, right, Lee?
Yeah.
He didn't mention aluminum and zinc, but he mentioned that in the book. So these are basically metals. The difference between those four metals is that copper, iron, and zinc are actually used in your body in small amounts. Aluminum has no use in the human body whatsoever. You don't have it in your enzyme systems or anywhere else. So it looks like if you have high exposures to copper, iron, zinc, or aluminum, you have a higher chance of getting Alzheimer's disease. There's also a genetic part of this. There's a gene you can get that either if you have two of them, you're more apt to get it if you have than you have one of them, or more apt if you have none of them. It's a recessive dominant sort of condition, but the studies have shown that even people with both genes will progress slower if you eat right. The other thing is, it looks like, the way I look at this is it's probably a metal toxicity, and those metals get into the brain, and they're facilitated getting into the brain by saturated fat and cholesterol. And the cholesterol can actually become oxidized in the brain, and that seems like a big part of it. Omega-6s, which we talked about, are the bad sort of omegas last time with the inflammation. They tend to be associated with worsening of Alzheimer's. Drugs will cause it, and will homocysteine. And we're going to talk about homocysteine when we get to vitamin B12, because we didn't talk about that with arterial disease, but it's an important concept. And you can reduce the risks by number one, avoiding those metals we just talked about. We're going to talk about that because Lee asked the question in a minute. And making sure you get adequate vitamin B12, B6, folate, and vitamin E, but not vitamin E in capsules. Taking over-the-counter vitamin E has been shown to increase your morbidity and mortality, in other words, your disease rate and your death rate. There's 4 different forms of natural vitamin E, and if you take an artificial form, it tends to damp down your other forms. So you want to get it in its natural form. Mental exercises help, exercise helps, sleeps help, and the omega-3s help. So let's go back, before we get into vitamin B12, let's talk about Lee's list here for a second. It's hard to avoid copper, it's in your pipes, right? Iron, shouldn't be cooking regularly off cast iron skillets. You probably shouldn't be taking multiple vitamins with iron in them, especially if you're a man. Zinc is also in multiple vitamins. Aluminum, leading source of aluminum in the American diet, processed cheese. They put aluminum in processed cheese to make it melt better and slice better. You also don't want to cook off aluminum pans, and you want to use anti-deodorants, not antiperspirants. Antiperspirants have aluminum. Yes, ma'am.
Is aluminum foil bad to use?
I don't know the answer to the aluminum foil question. It's a good question. I don't think, it probably depends on how much of it you're using and how much of it you use and bake with it, and how much contact it has physically with the food for how long. I wouldn't be concerned about that. I think I'd pick off the higher levels first before I worry about aluminum foil. Yes, ma'am.
I've heard that there's a correlation between heavy metals and ALS. Do you know that to be true?
I don't know the ALS. I didn't look at it for this presentation. ALS is a disorder that there seems to be a genetic predisposition for it, but it wouldn't surprise me if it didn't fall into this with certain metals and
The
stuff.
men who are deployed have a very high rate of ALS, we were told at the VA.
You know where the highest rate that ever was reported on Earth was?
Where?
Guam. 1/4 of the people in Guam got ALS. What's that all about, right? Well, they looked around. There's a toxin that is made by certain forms of algae, and it's a neurotoxin. That explains the ALS spikes around some of the lakes in New Hampshire, where the algae and moss form, and the water becomes higher with these toxins. But they looked in Guam and they couldn't find anything. And then they looked a little deeper, and what they found was one of the main dishes that the Guamanians liked were fruit bats in milk. They would eat fruit bat stew with milk, and fruit bats eat a thing off the trees, a fruit that had a lot of that neurotoxin on it as its complication. So that's the bad news. The good news is we gave guns to the Guamanians. We then killed off all the fruit bats. And no more fruit bats, no more ALS. So, I mean, you know, but I don't know about ALS and heavy metals, but if you go to nutritionfacts.org and look up ALS, I think you might find some of that information for you. Yes, sir.
Yeah, I have a question regarding iron.
Yes.
If one is low in iron in the blood, should he be taking iron pills?
Yeah, I think if you're low in iron, now here again, you've got to remember what is low. Okay, you've got a bell-shaped curve, and we set normal based on where 90% of people are. So you might be a little low normally, or you might be starting up high and be really low significantly. Most people lose iron women lose iron when they menstruate every month, but once you're beyond that once you've eliminated the curse, right, like it used to be called, you no longer lose the iron that way. The main way you lose it is in small amounts through your intestine tract. And you don't know it because, you know, it's just a small amount. So if you get iron deficient anemia, it's imperative to know, is that something that needs to be concerned about, like a colon cancer or something like that? Or is that just you're losing a little iron out of your GI tract because it's leaking a little bit? So if you're diagnosed as iron deficient, taking iron for short periods of time is probably an excellent idea, once you make sure there's not a significant cause for that. That gets into my former profession. But I'm talking about a chronic use of it long term, like in multiple vitamins people take every day, or people just taking iron supplementation because they think they're low in iron, those sort of things. So I don't know. So I think if it's low for a short period of time to get it, it's fine, as long as you make sure there's no upstream problem causing the difficulty that has to be dealt with. Yes, sir.
What about zinc? Where do you get exposed to zinc at?
Mainly in, well, there are some zinc cold products, and zinc is pushed as a prostate benefit, whatever that means. But it's also in multiple vitamins. So that's another reason not to take your multiple vitamins. Because you get, here again, it's concentrated nutrients that you get. It's like iron in meat, heme iron. Your body doesn't regulate its input. So people often get more iron in than they would take if they got it in plant products, which is a different type of phytoiron, which is regulated a little bit better by the body, because that's sort of how we was used to seeing it naturally, you know, before we got into the agricultural stuff. Yes, please.
Is zinc recommended for a cold?
Here again, I think it probably does shorten the duration. Colds, for the most part, are more of an annoyance, less of a problem. But here again, I'm talking about long-term exposure to things over time. And for short-term periods of time, if you've got a cold for a few days, taking some zinc, you know, lozenges or something like that, I don't think that's going to be a problem. Remember, dose makes the poison, right? So that over time, things can build up. Large amounts in short period of time will be a problem, but small amounts over a short period of time, your body is pretty well set to deal with it if it's a substance that's in the environment naturally. And there is zinc copper and iron out there naturally in the environment, as is arsenic. And we're used to dealing with that in small amounts. Our body gets rid of that stuff. There's a half-life in it. Yes,
So I
sir?
hear you say we shouldn't take multiple vitamins.
Yes, absolutely.
Should not.
Not. Or finish what you got. Don't buy any more. Or give them to your enemy. I don't care. So Alzheimer's disease has also been associated with high homocysteine levels. Now, homocysteine is a compound which is naturally produced in the body, and it's broken down by vitamin B12 and also facilitated by folate. So if you look at the vitamins that are associated with less Alzheimer's disease, you get B12, B6, and folate, and all these vitamins have to do with getting rid of homocysteine. Now, there are some conditions where people are born with high homocysteine levels in their body because of enzyme deficiencies. So they accumulate this stuff. Those people get heart attacks very early, they get arterial disease very early, and they get brain disease very early, like Alzheimer's. So you definitely want to maintain a B12 level that is acceptable, and when we talk about supplements, because B12 is the only supplement I would require my patients to take. Vitamin D is one of those precautionary things. Yes, sir?
What dosage?
25, well, that's an interesting question. Anybody in this room happen to watch Why Vegetarians Have Higher Stroke Rates? The webinar that was on nutritionfacts.org that I just finished last night? Before last night, I would have said 2,500 micrograms once a week covers your bases pretty much always.
What was the question?
Vitamin B12 dosage was the question. Dr. Greger in his webinar pointed out that for people over age 65, doesn't apply to anybody in this room except me, of course, should take 1,000 a day. So this last night I sent him an email. And you know, who knows where Greger is? I could look at his speaking schedule. He's going to 200 cities. He's going to be out of the office for 2 months. And he gets back to me and he says, because 500 doesn't work.
Yeah.
And I'm thinking to myself, well, I got 2,500s at home. What am I supposed to do with them? You know, do I have to take 1,000 a day? What is this? It's probably an absorption problem. So I sent him another email. He hasn't gotten back to me as of about an hour ago. So I'll let you know as the course goes on. I'm sure we'll get it sorted out. However, he is doing another webinar in May, all on B12. And he will, I'm sure I'll have the answer before that, because he's done the videos and the scripts for all these that he's going to do. But it looks like, there is a series of videos, and I'll try and remember to put it out in your pre-class readings. If you go to nutritionfacts.org in 2012, in February, or you just go to B12 on the nutritionfacts.org and go to the February and look at the one where he does the numbers to actually figure the number out he recommends. You basically want between 4 and 7 micrograms in your blood. That seems to be the best. And that recommendation changed a few years ago. That's where it is now. The thing is, when you take vitamin B12, there are some receptor sites in your stomach that grab on the stuff very quickly. And you'll get some very quickly that way, but those receptor sites won't work for 6 or 8 hours after it does that. It takes them a while for them to gear back up again. So you either have to take stuff on a regular basis to get it in, or you have to take a large amount, like 2,500 once, so that you get the 4 to 5 in, and then the rest gets in by passive diffusion downstream. That's his. So he does those numbers for you if you want to look at it. But it looks like I would start at this point with 2,500 once a week, sublingually, dissolves in your saliva. The saliva seems to protect it and help it get through the stomach a bit. But that's the recommendation at this point, and pretty much for all age groups.
Is there a test to find out how many homocysteines,
Yes.
what your level is?
Yes, we're going to talk about that, but since you raised it, we'll talk about it now. You can actually get a B12 test to see what your level of B12 is.
Right.
And a lot of people who are eating nothing but plants, because you're going to get some B12 from animal products because they get exposed to bacteria, which is what produces B12. And you'll get it that way, but even people on the standard American diet have a relative deficiency sometimes. So the B12 level you could get checked. If it's above about 400, you're probably fine. You're going to be fine. But you can actually get your homocysteine measured in your blood as well. and it should be in single digits. So, I wouldn't run out to your doctor and order these things, but if your doctor's going to order a blood test on you, say, hey, can you throw in a homocysteine level and a B12 level? Let's just check it, see what it is. Your plant-based milks, and all your milks, dairy, but also soy milk, almond milk that you get off the shelves that are refrigerated, almost all of them have supplemental B12 added. So for those people that put a little soy milk in their coffee or put soy milk on their cereal or something like that, you're going to get those small amounts of B12, and it's probably going to be enough. Interesting, in his videos last night, he mentioned that in Britain, it's illegal to add B12 to those products. If it's organic, you can't add B12 to it, which is interesting. Just a different, you got to know the rules of the systems you're working in, right? So, but B12 is important, and it is associated, if your levels are up and you have low homocysteine levels, you'll have less likelihood of having Alzheimer's disease. Yes, ma'am.
So you're recommending even people who aren't vegans to take B12?
I would recommend probably getting the B12 tested.
Oh, first.
Yeah, and the interesting thing about B12 is if you go from a standard American diet to a non-standard American diet, like where you're eating plants and things like that, for the most part, you probably have about 3 years stored. Your liver stores the stuff. So it is one of those things that it's not that much of a concern, but the trouble is it's hard to predict when it's going to be a problem. And it might depend on what you start with on a B12 level anyway. So I think getting a B12 level is pretty good. Now if it's down around 250, or something like that, there are some other tests that might be involved to figure out if that's a problem. Or you can just up your B12 and get it rechecked.
So
Yes,
we're
ma'am.
talking about low levels. What about too high levels of B12? That's
Yeah,
significant?
too high levels doesn't seem to be a problem at this point. There's some literature out there and some hype about it being associated with bone fractures and other things, acne, because there are cases where people get injections of B12 and they get acne afterwards. Maybe 1 out of 10 people. It doesn't seem to be a problem with the oral. So the oral doesn't seem to be a problem. It seems like you just get B12, you just pee it out. It's a water-soluble vitamin. It's not like A, D, or E, which are fat-soluble vitamins that can accumulate in the body. It's a water-soluble vitamin, so your body doesn't have abilities to store it. Does that answer your question?
So why so high if their body's not storing them? Why does it go levels so high?
Well, different people will hold on to more than others. They'll probably store a higher level. If you have a blood level of 750, you probably have more stored in your liver than if you have a blood level of 500. It's just variation from person to person and how much you take in and the forms it is. And we're also talking about cyanocobalamin. We're not talking about methylcobalamin, which doesn't have as long a shelf life, but it's effective. Yes, ma'am.
So what did you say the range is for B12 that you should have?
You probably should be above, well, when I was practicing back in the day, right, in 2008, it was greater than 250 was normal. But if you're taking regular supplementation over a 3 or 4 month period, it could probably go up to 500 or 600 or above 400. Once you're above 400, you're pretty sure that you're not going to have a homocysteine problem. But you could also just check your homocysteine level. And if
Right.
it's
Is there
single
a
digit-
too high level of B12?
No, you don't have to worry about that.
Okay, I'm good.
It's not dangerous. But A, D, and E are fat-soluble vitamins that you can get toxicity from too much. So here's John McDougall's take home. I don't know how many of you know John. He's a crusty old guy, but he likes to simplify things, and he thinks it's aluminum poisoning. Now this theory's been around for a long time, and there's a lot of support for this. And if you want to read about it, you can go to his June 2017 and 2004 newsletters. I think I may have put one of them on your pre-reading for your class. I think I put the more recent one on, but there's an older one on 2004 you can look out too. He thinks it's analogous to kidney stones. Kidney stones are interesting, especially if you don't have one, because if you have one and you're trying to pass it, you're doing this kidney stone dance because there's no way you can get comfortable, because basically you're trying to pass a very small, hard stone through a very small tube, your ureter, which goes down from your kidneys. You get formed in the kidneys and it drops down, and trying to get through that tube is not a picnic, okay? And so, but if you take those stones up and you dice them up, you see calcium or uric acid or different types of stones. Usually it's calcium, but the center of the stone is animal protein. So there's not a lot of animal protein in a kidney stone, but it looks like in cultures where they don't eat animal products, they don't get kidney stones. That's fascinating. So John's theory is that it's analogous to kidney stones, that the aluminum gets in the brain and then these things form in the brain, sort of like the kidney stones. Yes, ma'am?
Yes, when the body starts producing stones, like in the kidney and also in the gallbladder, is it the same kind of stone formation, or?
There are different types of kidney stones. The one in the gallbladder is primarily a cholesterol stone.
Okay.
And they're a little different. The ones in the kidney, there's 3 types. There's uric acid, calcium is the main, 90% are calcium stones. Then uric acid, primarily in people with gout, and there's oxalic acid stones, which can be associated with, you get a lot of oxalates in tea. But here again, I think the basic sort of building block that it starts at is an animal protein and then builds up. And also, clearly, if you have high fluid intake, high liquid intake of about 2 liters a day, 2 quarts a day, you tend to push things through your kidneys. Things tend to be less concentrated. If you've ever tried to grow crystals in a little solution, if it's more concentrated, you get faster, bigger crystals. If it's less concentrated, you get smaller crystals, or sometimes none at all. I was never ever able to do that. But I just wanted to make you aware that at least one of the more impressive people in this whole movement of lifestyle medicine, sort of, I think John's probably one of the most revered people in the field, and I know John personally, as well as anybody can know John personally. I think this sort of thing has to be taken seriously, and I would tend to avoid aluminum. He did say that there's a way you can get aluminum out of the body, and it's actually by drinking Fiji water, which is a silicate. There's silicates in it, and actually goes through the gut and actually leaches aluminum out. But whether that leaches is out of the brain, there's no controlled studies to show the use of silicated, water products affecting Alzheimer's. Here again, precautionary principle.
What kind of water?
Fiji water.
Fiji water?
Yeah, just silicate water. It's water with silicates in it. I don't know if John mentions it. Did anybody read the newsletter? I haven't read the newsletter recently that I sent out, but it's either that one or the previous one where he talks about silicates. I think it's a more recent one. So mental disorders. Why don't we take about a 5-minute break? And a lady came up to me and wanted me to remind people in the class about the forums that go on afterwards. There's a forum that goes on, there's a speaker series that the Renaissance Society puts on, and I wanted to make sure you're all aware of that. So she also wanted me to not pull people too late so they can't get to the forum. But I'm going to stick around to answer questions. Mental disorders. Now you're looking at a family medicine doctor who wrote a fair number of prescriptions for Valium and Librium and Xanax and antidepressants. And I was around a long time. And the first anti-anxiety drugs was Valium, mother's little helper, right? And Valium and Librium have fallen out of phase. They've fallen out of favor because doctors are starting to get the effect, the memo somehow with their patients that this wasn't working out as well as planned. It's definitely an anti-anxiety agent, but there were problems with it that were unanticipated. So the antidepressants are the most prescribed drug, psychiatric drug, and 13% of the population are on the medication. Now, the problem is, there's a book called Psychiatric Drug Withdrawal, a guide for prescribers, therapists, patients, and their family. It's a little pricey. It's a paperback. It's about $37. But if anybody is on antidepressants or is getting thought about having somebody on them or getting one of your family members is in that situation, I'd go to the library and check it out and read that section on it. We'll talk about it in a minute. The other book is a non-physician writer called Robert Whitaker, who wrote a book called Anatomy of an Epidemic. He also wrote one on schizophrenia in the United States called Mad in America, which we read in our book group. And in one of those embarrassing moments that almost happened that didn't happen, I heard Robert speak at the McDougall Advanced Study Weekend, and I was having lunch with him there, and I almost asked him if he knew the author of the person who wrote Mad in America, but I didn't, fortunately. He was the author, of course. So I almost put my foot in my mouth, but I didn't that time. But Mad in America just talks about schizophrenia. And actually, schizophrenia is a very bad disorder. The incidence is pretty consistent across the world. In Finland, they don't use drugs to treat schizophrenia. You can get them back to work in 6 months with family talk. Now, this is a published paper, but in this country, if you have schizophrenia, you're going to get put on drugs. And the problem with most of these drugs is once you're on them and you go off of them, bad things happen. And not only bad things happen, like you get the problem back again, but you use other things. You get chronic brain impairment, and you also get the inability to control your impulses. So you're on psychiatric medicine, you stop taking your psychiatric medicine, you lose impulse control, you pick up a gun, you go kill a bunch of people, and it gets in the news. And what do you need? You need more mental health care, which in this country equates to drugs. And there's usages for these drugs, but we're going to give you a little insight into some of the limitations of that. So we're going to talk about benzos, which are the Valium, Librium, Xanax type class. And they bind to certain receptors. We've gotten really, we don't have humility yet. We start identifying these neurotransmitters in the brain, and we start finding chemicals that we can give people to screw around with them. And we've got this complex system going on of trillions of neurons, and we think we understand what we're doing when we give people these drugs. And the interesting thing is, it does inhibit the firing of the neurons, but what happens is the brain adjusts to this thing that comes into the body. It decreases its output of the stuff you're blocking, and it also decreases the receptor sites. So this is the data that the makers of Xanax, to go unnamed, gave to the FDA. And this is 4 weeks of a trial that showed that placebo and the drug up here and placebo, the drug was better than giving people sugar pills. And based on this data, they got approved. So Xanax came out.
Jesus.
This is the data they had that they didn't give the FDA. They gave it the first 4 weeks. Notice that the drug is better than the placebo. After about 8 or 9 weeks, they stopped the drug, tapered people off, and didn't give them any therapy. And all of a sudden, the people who had been on Xanax having much more panic attacks, and the placebo is actually better than the drug after 9 weeks. Now, this, if they'd given the FDA all this data, they may not have got it improved, but because they only gave them this much data, it looked pretty good. So there's all this stuff going on out there. Now, that doesn't mean benzos are bad drugs. If you're in acute alcohol withdrawal and you're seeing pink elephants and you're having 102 temperature and you come into my emergency room, or emergency room where I'm working, I'm going to throw an IV in you and put you full of Valium. Probably on average about 70 or 80 milligrams. Normal dose is about 5 or 10 milligrams. That's what it takes to calm an alcoholic who's in DTs down. And at that point, you then taper the Valium pretty quickly. So acute usage of these sort of drugs, in some situations, is okay. But given what I know now, I would have a hard time prescribing antidepressants or anti-anxiety drugs or any medication for a long period of time. More than a week or two. Yes, ma'am.
I have a quick question. Can you define what is a panic attack? I mean, can a person who has a calm exterior and they're before their physician, and the physician is saying, well, you're anxious, what is a panic attack?
Okay, one of my pet peeves. I would see patients in follow-up back from the emergency room. They would go into the emergency room, they'd be told they had a panic attack, and they would be given a drug like this and sent home. And then they have a primary care follow-up, right? So they come into my office. I've never seen a patient panic in my life. So I don't like the term. That's the first thing. Second thing is, I think it's a physiologic reaction of overbreathing. I think you're overbreathing a little bit, so you're lowering your carbon dioxide in your bloodstream. And when you do that to people, they can seize. They can have seizures, they get anxious, they get chest pain, they get intestinal problems, all sorts of stuff hits the fan, and they have psychiatric problems. They think they're losing their mind. They won't tell you about this. When you start taking really good histories from people, there's something called chronic hyperventilation. I mean, everybody talks about hyperventilation. I've never seen a patient hyperventilate like that, brown bags and all that stuff. I would teach people like hatha yoga breathing techniques to slow their respirations down as a form of treatment as opposed to pushing drugs on them, and explain to them that it's a normal physiologic reaction to overbreathing. Now, most people don't overbreathe, but if you've got a lot of fat around your belly and your diaphragms are going like this instead of like this, and you're breathing shallowly, it doesn't take much to kick you into that physiologic state of overbreathing. So you get anxious about anything, you start overbreathing a little bit, you blow your carbon dioxide off, and you head for the emergency room. And they, you know, they do what they do in the emergency room. So I don't believe there is such a thing as a panic attack. I think there is hyperventilation, and there's acute and chronic, and I think it should be taught, I think people should be taught behavioral modifications to treat that and not use drugs and not labeled like they're panicking. I mean, these are real symptoms, and there's a physiologic basis for it. It's not that you're crazy. Although I know I've had patients be told that, yes.
I don't know if it's this drug. I have a neighbor, he talks to me because he has anxious, has anxiety.
Mm-hmm.
And he just changed from Kaiser to UCB because he said he kept getting prescribed these drugs and it used to hurt his brain. So I was going to ask you, does it?
I don't think it causes physical pain. I don't think the drugs cause physical pain, but they cause enough distress that you know, you start talking to people who've gone through with their own withdrawal from these drugs, and you get some pretty horrific stories. Now, the reason I was familiar with Bregan's book was Doug Lyle. You've seen his picture, right? Down here in Elk Grove. So I'm getting ready to be hired as a physician for the Sacramento Job Corps. I'm going to do a 6-month stint down there. Now, the Job Corps, there are 1,200 Job Corps sites around the country. It's a Lyndon Johnson program. We were doing medical records on charts, actual charts, not electronic medical records. It's very interesting to see an medical record. What a new concept. And I knew I was going to be taking care of a lot of 16 to 24-year-old people who were there to complete their high school education and learn a trade. And I knew because of their age that a lot of them were going to be on ADHD medications. About 20% of the population are on ADHD medications, you know, hyperactivity. And I told Doug, because I've been meeting with Doug periodically and seeing him about this, and I said, Doug, I know I'm going to have people on these drugs, and I'm going to have a psychologist on site, and I'd like to know what your protocol is for tapering these people. I get this short email back, not as short as John's emails, which are usually one word or two. He said, read Bregan, it's the Bible. Well, I've read it 3 times, and I was able to get about 25% of people off the ADHD medications down there while I was there over 6 months. But if you talk to people who were there, who are usually impoverished, and a lot of them didn't have medical care, that was the bad news. The good news is because they didn't have medical care, they didn't get put on the medication to begin with. So the incidence in that population of 400 people that we had down there, and this was a secure population, 2/3 lived off campus, 1/3 lived in dormitories on campus. It was really an interesting situation, a very good program, but only 10% were on ADHD medications because they didn't have access to the medical industry and because they couldn't be put on the medicine. But when you talk to people who had been put on the medicine and had taken themselves off those medicines, you start hearing really horror stories. So basically, Robert Whitaker, who wrote the book, Anatomy of an Epidemic, you want to minimize medications, avoid long-term treatment, and opt for conservative care. Read that to mean we need a lot less psychiatrists and a lot more psychologists in the world. Because the distinction is psychiatrists prescribe medications. They don't have to. Bregan's a psychiatrist, Peter Bregan. I was out at Rancho Cordova, my former where I ran the clinic, and I was getting something hacked off my cheek by it's cancer from the Mohs surgeons out there, and I happened to run into a doctor who I'd worked with out there for years, who's a psychiatrist. And we just coming in from the parking lot, and I had just finished. I was still out there, down there at the Florin Road facility with the Sacramento Job Corps, and I said, "Hey, Bob, what do you think about Bregan? And he just looked at me and said, Bregan is a menace. So, oh, okay, touched a nerve there. Then I walked in, and his clinic was in the same waiting room where I was going to wait for the Mohs surgery. He came out, sort of tried to smooth things over a little with me, but he wasn't very successful. If I was going to go into a psychiatric residency, I think I would finish it, and I would hang up my shingle and make a profession of getting people off these drugs. Because what you need is you need a willing and experienced clinician, and you need people around the people going through the withdrawal who can observe them and report if they're doing things like crazy things, like they lose impulse control or something like that, and you need a willing patient. The poorly anticipated side effects, other than the lack of impulse control, are something called chronic brain impairment, which is almost like a dementia-like situation these people get when they take the benzos and the antidepressants for a long period of time. So if you have anybody in your family, or you yourself are on any of these long-term psychiatric medicines, you might want to look into Psychiatric Drug Withdrawal by Peter Bregan. He's written a subsequent book by another guy, and I haven't read this one yet. I've read this one 3 times, but Your Drug May Be Your Problem sort of book. Okay? So that's it for mental health. There was a book out by Robert Saz, I think, in the mid-1960s called The Myth of Mental Illness.
Thomas Dobbs.
People remember that one?
Yeah, Thomas Dobbs.
Thomas, is that it?
Yeah.
Yeah. The take-home message from the book is, line all the psychiatrists up against the wall, shoot them, and the mental health of the country goes up. I haven't quite gotten there yet, but I'm getting close. Okay. So migraine headaches, different types of headaches. Here again, my industry is a fairly straightforward industry if you make the right diagnosis. When patients say they have migraine headaches, they mean they have a severe headache. When I say migraine headaches, it's a specific type of headache. It's not a muscle contracture headache. I don't even know what a stress headache is. I know people get a lot of stress headaches because they get headaches when they're under stress, but from my perspective, it's more what they're doing while they're under stress, tightening their muscles or overworking or something like that. I mean, telling somebody to get rid of the stress in their life is like telling them to stop drinking water and eating food or something. It's just, given the real set of the world, it's a question of coping with those things. But migraine headaches, we used to think were vascular, but it's a little bit more complicated than that. There's some real good science coming out about that. But the bottom line is you want to prevent them and you want to minimize your medications. And the lifestyle thing that seems to be most effective is getting away from tyramines. Tyramines often trigger migraine headaches. And tyramine is a very interesting substance. It's a normal amino acid in foods that is more prevalent in foods as leftovers. You know, foods sit for a while, their tyramine levels go up. So I had patients who would come in with migraine headaches. I had one lady cut her headaches in half. She was using meat tenderizer on her hamburgers on Friday night. She would get a migraine headache every Saturday. She stopped the meat tenderizer, migraines went away. Another patient eliminated all her migraines by getting off peanuts. It's very specific for individuals. There are low tyramine diets you can get on the internet, and things like pickles and preserved foods and certain types of alcohol are very high in tyramines. Your processed meats are very high in tyramines. And people who have leftovers. So people would come in, they're under stress, and they get a lot of migraines. And it's like you find that they're skipping meals. So when you skip meals, you eat bigger meals. And when you eat bigger meals, you get exposed to more tyramines than if you ate smaller meals. Or you're running around and you're eating a lot of leftovers, so you've got more tyramines in your leftovers, so you're triggering your migraines. It's very interesting. Aerobic exercise seems to help. Maintaining a healthy body weight always helps, because as we talked about, when you have a lot of fat on your body, you've got an inflammatory state. Yes, sir?
When you say leftovers, are you talking about meat leftovers?
Any leftovers.
Oh, any leftovers.
Yeah, there's tyramines in plant food as well. It just is it's a breakdown product in the foods. Now, there's 2 ways we approach migraine headaches. I mean, I always approach it by trying to get people on the lifestyle wagon first. But there is prophylaxis where you give people drugs on a regular basis to actually prevent them from coming. And these take non-drug and drug. These are over the counter. So there are things that have been proven to actually decrease migraines when you have them. And then, of course, there's intervention once you have a migraine right away. We used to use Cafragot all the time. The non-steroidals like Motrin and aspirin at certain doses help. The triptans, which were a real good advance for breaking migraines. And there are some non-drugs like ginger and things like that have been shown in studies. So I don't want to get into the drugs and the treatment too much, but just to be aware that if people in your family, it's usually women, it's usually younger women who have these, there are ways you can actually, in lifestyle method, to actually work on preventing them. The low tyramine diet. And you keep a food and elimination diet. If there is a pain diet out of university in Turkey, which I came across, it was actually published, it looks pretty good. Unfortunately, I had a low tyramine diet when I was at Permanente that was given to me by a pediatric neurologist in our Walnut Creek facility, and I Xeroxed it so many times it was getting faded. And when I retired, I thought I brought it home, but I can't find it. So it's one of those things that got away that I wish I had, because it was very successful for me over the years. Now we'll talk about a little about supplements. We talked a little earlier, but I want to get back to them. So you can get tested for B12 and homocysteine, like we talked about. It's 2,500 micrograms orally of cyanocobalamin. Methylcobalamin works well also, it just doesn't have as long as shelf life. And you can, so it's weekly, daily, and then there's over age 65. I don't know about that yet. I got to check with Gregor. I'll get back to you. I'm sure I'll have the answer by the end of the course. If not, I'll try and get you the answer after that. Vitamin B12 is the only supplement that isn't in the food supply, basically. It's made by bacteria, not plants. The animal products don't get it. They get it from bacteria because they eat a lot of bacteria. There's a storage of 3 years in your liver for the most part, so if you have some backup. If you miss a dose, don't worry about it. Vitamin D we talked about a little bit last week. This is an interesting situation. It's a fat-soluble vitamin. It's actually a hormone, number one. It's produced, your body produces it from sunlight. Remember we talked about its effect on the blood arteries, as well as all the other hormonal effects it has, like cancer and all these things. It can be toxic. With your levels over 100, you get headaches. I had one patient come in who was having headaches, and his level was 120. He was being seen in Mexico and treated for cancer, sort of a non-traditional treatment that was giving him very high dose, like 10,000 units of vitamin D a day or something like that. He had headaches. And because it's not soluble, it builds up in the body. The current recommendation was greater than 20, but it just got cranked up to greater than 30. We do that all the time, cranking things up to sell pills to people. There was one study that showed that some Hawaiian lifeguards who had, you know, these people were bronze, right? And they had levels of like 26. And if somebody like that walked into my office, I would never prescribe them vitamin D, because they're not deficient. They're just at one end of a bell-shaped curve where their body doesn't think it needs vitamin D. So it's reasonable, if you take 2,000 to 3,000 units a day, you will not get up to a toxic level. The studies have shown that. You will probably be, almost certainly be above 30. So if you wanted to take vitamin D, just don't get yourself in trouble. Take 2,000 to 3,000 a day, or take 5,000 every other day. If you miss a pill occasionally, it doesn't matter. It's fat soluble, it builds up. But those are the only two isolated supplements that I would talk about. Iodine is something you need. It's in salt. The reason it got into salt was because in Colorado in the 1920s, people were developing goiters from lack of iodine. The vegetables and produce that are grown in the middle part of the country are deficient in iodine. The produce grown near the coasts are not deficient in iodine. But we get enough salt exposure in this country that we don't have to worry about it. Except all those specialized salts people are buying, you know, Himalayan sea salt, or, you know, all these specialty salts. Those are not iodinated, you know, so that might be an issue. You can also get iodine in seaweed, but there's some seaweed you shouldn't take, and I don't I don't like the taste of seaweed, so I haven't paid much attention to the literature. But if you're a seaweed person, you can go to nutritionfacts.org and learn a lot about seaweed and what you should and shouldn't take. Okay. Now, the next patient is one of my patients from the Berkeley Meals for Health program. And I want you to hear from her because she was taking supplements that did something sort of surprising.
Been incredible. I'm one of those where things kind of went in reverse, kind of backwards. My blood pressure was normal, it was stable, but I had to give up all of my habits, my cookies, my chips, and all of that, so I wasn't getting my fix. Eating the good food, my blood pressure went up. It went up incredible. It was 208 over, it started out 89. By the time I had the discussion with the doctor who wanted to immediately put me on 2 drugs that I never had contact with, it was up 235 over 99. And I ended up in emergency with them trying to bring my blood pressure down again. And Debbie told me I was free to call Dr. Don. Well, if you ever talk to him, when he says hello, you're immediately calmed down. I mean, it was incredible. He calmed me down. My blood pressure came down. We talked for about 15 minutes. He said, try not taking any of your supplements. Maybe you don't need them now. Sometimes, you know, when you're on this program, your body is cleansing itself and maybe something is clogged up somewhere and you don't need the supplements. I stopped taking the supplements and my blood pressure is 118 over 60.
Yes, I also want to thank the program.
So she was on about 3 or 4 supplements, and her report of what I told her is a little different than what I think I told her, but we usually stop all supplements on the first day of the program, which is what I probably recommend, but she had continued taking her supplements. Now, she was taking several. I could go back in the record and look at what they were, but none of them, from my memory, were known to cause a lot of high blood pressure, but for her it was a problem. So all these supplements that she was taking were causing a problem for her. But once she started eating right, she became, and we don't know anything about why that was, or the mechanism, or the biochemistry of it at all. She was just doing a lot better, and she was happy about it. So just get back to remember the assumptions we've got going on. Nobody gets out alive. Everybody does 24 hours every day. Everybody's an experimental one, and we're group animals. So I wanted to wrap it up today, leave a little extra time for questions. So remember, here's the lose some weight, quit smoking, move around more, and eat the carrot, right? So we're talking about whole plant foods. We haven't really got into fitness yet. We've defined it, but we'll get into it more as we go along, primarily in the last class. Vitamin B12 we've covered pretty well. Non-smoking is clear. Lean body weight, avoid toxins. And we've now redefined toxins for you. Some of those things in your environment that you used to not think are toxins are now maybe you're thinking are toxins. But remember, it's a dose that makes the poison. You might be able to tolerate a little bit of something that comes in a natural form, but when you're taking concentrated nutrients, your body isn't used to getting them that way, and probably not doing you very much good. So this is Dr. Greger. He's crazy. He's a nerd, but the website's highly successful. He's written 2 books, How Not to Die and How Not to Diet. They're both on the New York Times top 10 bestseller list at this point. So the nonprofit is doing very well. It's a free website, short videos. The nice thing about the videos is you can actually get the sources that he talks about, and if you click on the source, if you get the article, it'll give you the abstract of the article free. Now, I often get asked, why do my doctors not know this stuff? And then I find out that 27 of our volunteers last year screened 37,000 articles for this. That's just human nutrition. There's no way your doctor can know about this stuff. Even if he got it in medical school, when I got it in medical school, we got a little bit back in the 70s. We've learned a little bit since then. So it's keeping up, and keeping up with the science. This is the best website. One of the problems with this is he doesn't provide the context, the clinical context for it. There is the ability to ask questions. He's now started doing webinars. which come out periodically, and I think there's a recommended donation of $20 for the webinars. They're about 2 hours each. The one that I was watching last night was why vegetarians have higher stroke rates, which they do, and it's because of homocysteine levels, because they take inadequate vitamin B12. There's John and Mary McDougall. John has a free website, newspapers, there's a lot of free videos. His book is The Starch Solution. His big thing is starches, you know, the 500 calorie per pound. Potatoes, sweet potatoes, rices, grains, half your plate. The other half are vegetables and fruits. He has a lot of success stories. They call them McDougallers. You know, it's kind of crazy that he was working down in Santa Rosa while I was working up in Sacramento. He's only like less than 100 miles away, right? And he's coming out with all these books, you know, the McDougall program, the McDougall diet. And it's a very interesting practice. You know, he would only see people 8 times a year for 10 days. That's like weird. The rest of the time he's reading the literature, writing books, answering emails, 1 or 2 words at a time. But, you know, very brief. But that's what he did. And people would come in occasionally and say, what about the McDougall program? I don't know anything about the McDougall program. They were also believing grapefruit diets and the ketogenic diets and the paleo diets and, you know, this diet and that diet. Didn't know, you know. So I put both pictures up there because Mary's lived with this guy for a long time. The reason John sort of got into this neck of the woods is sort of an interesting story, but he had a stroke when he was 18. But he was paralyzed in a hospital bed for about 2 or 3 weeks. On one side, he still walks with a limp. And at that point, he was drinking alcohol and smoking, and then he went to medical school, and he and Mary went to Hawaii for the internship. Then he went and took care of people on a sugar plantation. He was one of the 2 doctors on a sugar plantation. So they were captive on an island, 5,000 people, doing brain surgery and sewing stuff up and delivering babies and doing all sorts of stuff. And he was noticing that the pills he was giving patients weren't helping them so much, but also that there was generations, that the younger generation looked sicker than the older generations. So he figured it was something he was doing wrong. So he went back and did a residency in internal medicine and then went to work in private practice in Hawaii. And then he got lured over to the St. Helena Hospital in Santa Rosa, a lifestyle for people there. And then he ran afoul with the cardiologist in the hospital and left and went over to Flamingo, which is where he was starting in 2002, which is where he saw patients until he retired last year, actually a couple years ago, and turned it over to Anthony Lim, who's a family medicine doc who's also a lawyer, totally undereducated guy. And he sees the patients there, but it's still run as the McDougall program. John comes down and gives lectures now. But Mary's the one behind all the recipes. My wife and I don't use a lot of McDougall recipes. For us, they're not quite as spicy, but I think what you'll find is as you go around and shop for different recipes, as you change you'll find your own favorites and stuff like that. Just find the recipes you like that you've been making all the years and just make them healthier. All the spices are fine. And then there's Neil Barnard, who was particularly instrumental in my career because he wrote a book called Neil Barnard's Program for Reversing Type 2 Diabetes, which to this day still is the best one I've seen. And it's really soup to nuts. And when I started using that with my patients in 2006 or 2005, they started reversing their diabetes, and that's sort of how I got here. But what I like about the Physicians Committee for Responsible Medicine is that all their material's free too, for the most part. I mean, you can buy some books from them and things like that, but John, Michael, and Neil all have pretty much free stuff. The one thing that PCRM does that the other 2 don't do is they're very effective at lobbying Congress, getting things through Congress. I joined a lawsuit for them. I was one of 4 doctors in California that sued the FDA over the cholesterol things. That they didn't drop the suit, settled. The lady who was pushing that was getting her funded, and she was a professor at Tufts University. She was on the chair of the committee that was making the recommendations. She just happened to get all her funding for her research from the egg industry. So PCRM first sued to get access to the background of people on the committee that were making the recommendation, and when they became that aware, they were going to basically remove cholesterol as a nutrient of concern. That's what led to the suit. Currently, I'm one of a number of named physicians on a suit against the state of California to try and get processed meats added to the Prop 65 carcinogen. It's a class 1 carcinogen, and we're feeding our kids that in schools. So once the California state government designates it as a class 1 carcinogen, I don't think they can sell it, they can give it to the kids in schools anymore. But that's out at this point. They've been trying to, PCRM working with some other organizations have been trying to pressure the state of California to do that for a while, but they've been doing what a lot of bureaucracies do, which is nothing.
How do you define processed meat?
That's a good question. I'm sure there's a definition, you can look it up, but I would say things like hot dogs, bologna, non-foods like Spam, which I've never really had much use for, but that's right.
You characterize it as class 1 carcinogen. Several class, one more potent as class 1 as well.
Yes, it is. And the class 1 carcinogens, I think the processed meat used to be class 2, but they bumped it up to class 1. Class 1 is like cigarette smoke, asbestos, things that have been pretty well shown beyond any result to lead to cancer.
As the class number decreases,
Yeah, it's less. Class 1 is the highest carcinogenic class. It's sort of, you're right, it's sort of backwards. It maybe should be the other way. Okay. So then we get out a little early. Any questions?
I have a question about
Yes. Yeah, so you're getting all the iodine you need if you're taking any salt at all in your diet. You're getting all the iodine you need. The question has to do with if you're on thyroid medicine, can you take iodine supplements? And my answer is you probably don't have to because you're getting enough iodine in your environment. We're going to talk about, next week we'll talk about the autoimmune disorders. And low thyroid is probably one of the most common autoimmune disorders where you've attacked your thyroid and you're not unable to make your thyroid hormone anymore, and then we give you a thyroid hormone, which when I was starting out was horse thyroid, but now we've got human thyroid, fortunately. So you're getting the real stuff. Yes, ma'am.
On one of your slides there, the end, you had CoQ10 up there, and I'm sorry I didn't understand if it was a good thing or a bad thing.
It was one of the things you take for migraines to actually prevent them from coming.
So it was a good thing.
If you have migraines.
Yeah, okay.
But I would try to avoid the tyramines first before I would go out. CoQ10 is pretty expensive.
Yeah.
And I might try the other ones first, which are a little cheaper.
If you were trying to reduce the number of medications that you take,
right.
How would you go about it in a Kaiser environment?
So the question is, how, if you're taking multiple medications, how would you know which ones to start with first? Number one, it would depend on what medications you were on. If there were a bunch of psychiatric medicines, actually Bregan does a chapter in his second book on how to fix which ones to go with first. I would have a tendency, it's a difficult question, it would depend on the exam and physical components. I mean, whether you go after blood pressure medicine first or the psychiatric medicines. What I think I would do is I would change the lifestyle first, and based on how that turned out, I would look at the drugs that you were given. Because, for instance, I would get a lot of people coming in with fatigue, and I would just tell them they were out of shape for life, but I didn't know much about the nutritional stuff. And what we find with the nutritional stuff is that when people start eating correctly, a lot of people feel that their energy levels go up. And I don't know why that is, but it's fairly well reported. Just like I have patients whose inflammation, like the first lady, the 81-year-old lady who reported, her knee pain went away. That inflammation went away. It's often within the first week. And we'll get into that more in the 5th class when we talk about arthritises and inflammation. But there's a substance that is made that causes inflammation in the arteries that probably causes inflammation in the joints. And when you stop eating animal products, that goes away. and it goes away within a week. So when people come back to me a week or two after they've changed their medicine and say, I don't get these aches and pains anymore, that's probably what was causing it. Now, there's probably a lot of things that can improve over time, and one of the problems people have when they're adjusting lifestyle, and a lot of the doctors don't appreciate this, you can get some results fairly quickly, but it can also take months for something to become apparent. That's why you're sort of an experiment of one. So it's a difficult question, and working with your doctors, I think, would be the best way to
Are you
consider it.
saying it's complicated?
It's individual. It's individual. I think I would probably tend to start with the drugs that had the worst side effects, potentially. You know, if they just had bad long-term side effects, I'd want you off those first, if that was at all possible. But it's an individual decision, I think. And I mean, I still, up until next month, until April, I still have a prescription pad and I'll be licensed in the state of California, but I'm surrendering my license. So I won't be writing any more prescriptions, but I do write prescriptions, and I have written 1 or 2 in the last 10 years. But they're not nowhere near what I used to write when I was returning. Anyway, thank you.
Thank you.